Hi there, and welcome to your post-op instructions. I'm going to be going over a couple things to expect during your recovery and things that you can and cannot do. First and foremost, no pressure inside the mouth. That includes smoking, spitting, drinking through a straw, heavy lifting, and swishing. You want to refrain from doing that for a minimum of 3 days after your procedure. Swelling, bruising, and bleeding is to be expected a few days after your surgery. Remember, although the mouth seems like a very small area, it is a very intense procedure. So although it is very expected, if you have any concerns, please do not hesitate to give us a call. Swelling and bruising can be alleviated by using ice packs the first 3 days. 15 minutes on, 15 minutes off. Continue to do that throughout the day. Target the outside of your mouth with ice packs and the inside with popsicles, ice cream, cold drinks, cold soups, things of that nature. After about 3 days, cold won't really do much for you. At that point, you want to switch it to heat, doing the same thing. 15 minutes on, 15 minutes off. Bruising can be present for a period of 5 to 10 days, and in some instances, can last longer depending on the surgery that you're getting done. Bleeding, like I mentioned, is to be expected and will occur for about 3 days after your surgery. Major bleeding can be contained with a tea bag applied to that area for 15 minutes. Excessive bleeding should be reported to our office for further instructions. A mild fever can occur within 24 to 48 hours after your surgery, and that is very normal. A persistently raised temperature should be reported to our office. Nausea after surgery is usually due to taking medications on an empty stomach. Please make sure you have at least some yogurt, a protein shake, something in your belly before you take those medications. Small pieces of bone can begin to work themselves out of the surgical site for up to 6 weeks after surgery. Numbness of the lips and the tongue can be apparent even after the anesthetic has worn off. Time will take care of this. This usually occurs more frequently to patients that get surgery done on their bottom jaw. All of these can remain numb for a few weeks, even a few months. That is completely normal. However, as with any concern, if you experience any numbness, please notify us at your post-op appointment. Remember, no smoking. Smoking can increase pain and lead to poor healing. The longer you refrain from smoking, the less chance you have of problems arising and the higher chances you have of the surgery being successful. You should not smoke for a minimum of 6 months after your surgery is performed. Now, in regards to your diet, nothing hot in temperature, nothing spicy, nothing with tiny seeds, no carbonated drinks. And you want to refrain from consuming any of this for a minimum of 5 days. Remember, anything hot in temperature and anything spicy will cause these areas to become very irritated. Anything with tiny seeds can get caught in the surgical sites and possibly cause an infection. Carbonated drinks causes dry sockets. Very, very painful. I do not recommend it. Refrain from any carbonated drinks. Soda pop, apple cider, beer, things of that nature. Do not consume them for a minimum of, like I said, 5 days. In the previous video, you did receive a list of items that we do recommend for you to have on hand. And essentially, you just want to stick to a very, very soft diet. Remember, your surgery is fresh. We don't want to disturb anything inside of your mouth. We do want everything to heal properly. Please give it the rest that it deserves. Give your body the rest that it deserves. Soft foods include mashed potatoes, yogurt, protein shakes. Rule of thumb, if you cannot pinch it with your fingers, you cannot consume it, at least the first 6 months. Again, you want these areas to heal up very nicely, especially if you had implants placed in your mouth. Give that implant time to rest. Give that implant the adequate amount of time to integrate with your bone. Excellent oral hygiene should still be continued in any areas of your mouth that were not treated surgically. If you received the Stella Life Recovery Kit, please continue to use this for 1 whole week. Again, instructions are on the side, and you did also receive the pamphlet with all the instructions. Now that it's after your surgery, you are going to start including the spray as well. You should start using your WaterPik 3 days after your surgery. The instructions are written on the container for whichever WaterPik you got. If you feel uncomfortable, do the best that you can. When you come in for your post-op visit, we will go over exactly how to use that WaterPik. But in the meantime, just do the best that you can. You should start using your toothbrush at the same time, 3 days after your surgery. Be very gentle, but nonetheless, still toothbrush. Remember, no toothpaste. Toothpaste is very abrasive, and you're gonna start to take away all that shine and all that polish from your prosthesis. And last but not least, your prescriptions. More than likely, we have sent these prescriptions prior to your surgery day, and you would have already started the antibiotics. In some cases, the day of surgery, Dr. Raissi will prescribe you more antibiotics. If that is the case, please finish any remaining from the first prescription and immediately start the second. Whether you are in pain or not, please continue to take those. During the day, for any discomfort, you can use a combination of Tylenol and ibuprofen. The exact recommended dosage for each can be found on your printed post-op instructions you will be given the day of surgery. In conclusion, take it easy. You just had a major surgery. Follow these post-op instructions to ensure a smooth recovery. And keep in mind, this too shall pass. This is just a very small part of your journey to your new smile. Soon enough, you'll be eating steaks, corn on the cob, chomping down on trees. I'm just kidding, don't do that. We'll see you soon at your post-op visit. Bye.